Hello, my name is John Horace. I'm a social worker here at Spaulding Rehabilitation Hospital for Continuing Medical Care, Cambridge. I also co-chair the Patient and Family Advisory Council and serve as a member on the Patient Experience Committee. We want to welcome you to Spaulding Rehabilitation Hospital for Continuing Medical Care, Cambridge. As healthcare providers, we know that being in the hospital can be very hard on our patients and their loved ones. It is our job to provide you with the best experience possible. If at any point during your stay you have ideas for how we can improve, we certainly want to hear it. Your feedback is valuable, and it is one of the best ways we can improve your experience. We would like to provide our patients and their loved ones helpful information about what to expect when admitted to Spaulding Rehabilitation, Cambridge. Whether you are viewing this video in the beginning or middle of your stay, we hope that you find this information useful. If you have any questions about the information presented today, please ask any of your care providers. Being admitted to a new hospital certainly raises many questions. We want you to know what to expect to ease any anxiety you may have. When you come to Spaulding, you will meet many new faces that are part of your care team. Within the first 24 hours, you will meet your physician and some of our nursing staff. By day 2, you will be evaluated by our therapy staff. This will include physical and occupational therapists, as well as other members of our care team. As our patient, you have a team of healthcare professionals that will interact with you during your stay. Each of these people are important to your experience, whether they provide direct clinical care, clean your room, or coordinate your discharge. Now let's take some time to discuss what each of these healthcare professionals do. We pride ourselves on taking a team approach to care. The most important members of the team include you and your loved ones. We value setting goals that are meaningful to our patients and their loved ones. The team will work together to set realistic goals that are attainable and meaningful for you and your loved ones. Now let's learn about the roles of each member of your care team. Each patient will be assigned an attending physician who will oversee your care. We always have physician coverage in the hospital 24 hours a day, 7 days a week. So if you need to see a physician when your attending is not in the hospital, there will always be someone in the building. Often, our patients need to be seen by specialty physicians. We have a number of specialty physicians who may also provide consultation. This may include pulmonologists, cardiologists, rehab physicians, and psychiatrists. Your attending physician can help determine if it is appropriate to consult a specialist. Nursing staff. We also provide around-the-clock nursing coverage, including care from registered nurses and patient care assistants. Our nursing staff works either 8 or 12-hour shifts. It is always our goal to provide consistent nursing coverage to the best of our ability. Our nursing staff works in teams, and you will likely meet several members of your nursing team within the first week of admission. We also have a nurse director assigned to each one of our units who is here Monday through Friday. When the nurse directors are not on site, such as overnight and weekends, a nursing supervisor is present. If you have any concerns, please ask for the nurse director or nursing supervisor, depending on the time of day. When we refer to nursing staff, we are talking about 3 different types of professionals. They include registered nurses, patient care assistants, and unit service aides. Each provide an important and unique role in your care team. Our nurses provide a number of important roles, not limited to the ones listed here. They monitor your medical status, provide medications, complete wound care, and communicate medical concerns to the team and physicians. They are also here to educate you and your family about your care. Our patient care assistants, or PCAs, will assist with your personal care needs such as toileting, bathing, dressing, feeding, repositioning, etc. They also help with taking vital signs, weights, and blood sugars as needed. They often answer the call light, though the entire team is responsible for responding as well. We also have unit service aides, also known as USAs, who do not provide any clinical assistance. They deliver food trays, restock supplies on the units, and assist with transports. They may also answer your call light, but because they are unable to provide clinical assistance, they will assist with reaching out to the appropriate staff to meet your needs. We also have a very robust rehabilitation department that includes a variety of therapists. When you arrive, your physician will enter orders for these therapists to complete evaluations. You will be evaluated by physical and occupational therapy within your first 48 hours of admission. This is when you would receive speech therapy if appropriate. The therapists will evaluate and determine the appropriate frequency of therapy. Therapy sessions typically occur during weekdays between the hours of 7:30 a.m. and 4:30 p.m. You will be provided a schedule that includes the times your therapy will occur each day. Now let's review the types of therapy services available. You will learn more about what each discipline works on when they provide therapy to you. Physical therapists, often referred to as PTs, will work to improve your overall physical strength, coordination, endurance, and ambulation to promote independence in your daily life. These include things like walking, sitting balance, and wheelchair mobility. Occupational therapists, or OTs, target various goal areas including improving activities of daily living, which may include dressing, bathing, and toileting. They also work on cognition, vision, fine motor skills, and overall strength. Speech therapists, or SLPs, also provide therapy to those patients who need it. SLPs work to address cognition, speech, language, motor speech, voice, and swallowing. Some patients also work with rehab aides. Rehab aides may work with you to provide more opportunities to work on therapeutic goals. This may include improving strength, fine motor skills, stretching, endurance, and cognition. This is a brief overview of our rehab department, but you will certainly learn much more as you work together in therapy. At Spaulding Rehabilitation Cambridge, we have respiratory therapists available 24 hours a day, 7 days a week. Our patients are seen by respiratory staff if they have oxygen needs or require support such as a trach tube or are on a ventilator. Respiratory goals focus on improving respiratory support and providing education for managing your respiratory needs. In addition to our wonderful therapists, we also have a number of nutrition and dietary staff. Our registered dietitians consult on all patients to ensure adequate intake of calories, protein, vitamins, and minerals, and provide related education. We also have diet techs who visit patients for meal ordering and to address any questions about the menu. For meals, you may be placed on a diet order based on your medical concerns. This will guide your offered menu items. Spaulding has a rotating 2-week menu. You may request printouts of our menus. Food is ordered at least 1 day in advance, and there is an always available menu that has additional food options to choose from. If you have any special dietary considerations or food allergies, be sure to let a team member know. There is variation in set meal times depending on the unit you are on. In general, breakfast is served between 7:30 and 8:30 a.m., lunch between 11:30 a.m. and 12:30 p.m., and dinner between 4:30 and 5:30 p.m. You will be assigned a case manager when you are admitted. They will meet you within the first 72 hours of admission. Your case manager will update you about your plan of care and facilitate ongoing coverage with insurance. They also develop a discharge plan with you, your loved ones, and the interdisciplinary team. Your case manager's discharge plan includes determining the length of time you will be at Spaulding Rehabilitation Cambridge and deciding your discharge location, such as home or another facility. They may also assist in setting up equipment, education, and services you will need upon discharge. The team at Spaulding Rehabilitation Cambridge includes social workers on staff who may be a part of your care team. These professionals are available to you and your family to provide support with your social, emotional, and interpersonal needs while you focus on recovery. If you or your loved one would benefit from a social work consultation, please let a member of your care team know and they would be happy to arrange a visit for you. Our spiritual care department offers compassionate support in the form of religious tradition, spiritual practices, or person-centered dialogue to patients of all spiritual levels. Our chaplains service all religions as well as those who may not identify with a religion to offer a sense of connection, comfort, and peace to patients in times of illness or uncertainty. If you would like to meet with a member of the spiritual care department, please let one of your team members know. Safety is a main priority at Spaulding Rehabilitation Cambridge. Our security team is always on site and has many cameras in and around the hospital. If you have any valuable items, they can be locked away in security at any point during your stay. You can access those items anytime, day or night. If you need information related to parking or the visitor policy, please dial 0 from the bedside telephone. Visitors or loved ones may also stop by the front desk and ask for assistance from security. During your stay, you will see environmental services staff throughout the hospital working hard to keep our facilities clean. Our staff works throughout the facility cleaning rooms, medical equipment, and common areas. You can expect environmental staff to be in your room collecting trash, cleaning, and removing soiled linens throughout the day. If you need to contact a housekeeper, please call the numbers listed. We do our best to limit the number of outside appointments for our patients. However, if medically necessary, we will arrange for ambulance transportation. When possible, we encourage virtual visits with outside physicians. We have several services on site, including lab services, dialysis, and radiology. Every patient has the right to receive information in a manner they understand so they can fully participate in their care. We provide free interpretation service to all non-English speaking and limited English proficiency patients in all languages. Please ask a member of your team if you need an interpreter. We understand that being in the hospital can be challenging for many reasons. We have a number of shared spaces throughout the hospital that you might be able to access. Please remember to always check in with your nurse prior to leaving the unit. Our courtyard offers a nice outdoor place to enjoy, weather permitting. It has plenty of tables and chairs that patients and families often enjoy. Many also enjoy the flowers and spending time around the fish pond. The Cullinane Center is located on the first floor between the main elevator and the courtyard. The space is used for special events, group therapy, and common use. The room has a baby grand piano, a fish tank, and a public use library. We have a meditation chapel that is also located between the main elevator and courtyard. It is always open and available for use by patients and visitors. The cafeteria is located on the first floor towards the rear of the building. It is open daily and offers breakfast, lunch, dinner, and snacks. The hours can vary, so please check signage outside the cafeteria for hours of operation. Here are some insider tips to consider during your stay. As we mentioned before, the cafeteria is located on the first floor. Patients and their family are welcome to access the cafeteria, but just a reminder that as our patient, you are required to have permission to leave the unit and must adhere to diet restrictions. There are also vending machines located on the first floor outside the cafeteria. Patients may also use local restaurants who may provide delivery. Spaulding Rehabilitation Cambridge is also fortunate to have a popular pet therapy program. We have certified therapy dogs that usually visit 1 day per week to all units. Please contact a member of your therapy team for more information. You will also receive a strength binder as well as an admission packet, which will provide you with further information regarding hospital rules and policies, as well as frequently asked questions. The team at Spaulding Rehabilitation Cambridge is dedicated to treating every person with the utmost respect and dignity. If you ever feel that you are not receiving the respect and care you deserve, please let a member of your care team know, and we will be sure to address the issue immediately. Thank you for choosing Spaulding Rehabilitation Hospital for Continuing Medical Care Cambridge for your care. Each of us strive to provide excellent care every single day. Please reach out to a member of your care team if you have any feedback on how we can improve the care provided, and a member of the quality team will be happy to meet with you.